Hi, everyone. It's Lee Clark, Director of Patient Services with the Aplastic Anemia and MDS International Foundation. Welcome to Podcasts for Patients. Before we get started, I'd like to recognize the generous support of our Diamond sponsors, Alexion and Novartis, and the generosity of our patients, families, and caregivers who, without their support, this podcast would not be available. So today I have the pleasure of speaking with Shane. So welcome, Shane. How are you?
Hi, Lee. Thanks for having me. I'm doing well. And how are you doing?
Doing great. Thank you so much for asking. Tell us a little bit about yourself.
Yeah. Hey, folks. I'm Shane, like Lee said, and I'm from Canada. I'm a 27-year-old guy living in Canada, and I'm a PNH patient.
Thanks, Shane. Tell me a little bit about your life before your diagnosis of PNH.
Yeah, life was quite different than it is now, but life was good. I was working full time. I'm a social worker by profession, so I was doing a lot of my passion work. That's how I like to call it. Yeah, I was busy with work. I was going on trips, vacationing with friends, with family, with my loved ones, just really trying to enjoy the little bits of life outside of work and outside of the busyness of life, and just trying to, take care of myself, my loved ones. And I have two cats who I adore. And so, yeah, life was pretty good. And I would consider myself relatively healthy, and I didn't really necessarily access healthcare much. I'm definitely not someone that goes to the gym or, exercises much, but overall, I think I was relatively healthy and just kind of lived my life that way. I was someone who loved to dance, who loved just to have a good time when I was out with my friends, and a little bit of innocence. I had a little bit of innocence in terms of my health and not knowing what would come next.
What led you to seek medical attention?
I actually went down south to Dominican Republic for my best friend's wedding. Super exciting. This was back in April of 2024. Super pumped. First time being there. An all-inclusive resort. So, that comes with its perks. And the traveling there was fine. Once we got there, we had a really good time. I was actually emceeing my best friend's wedding. And it was just a lovely time. The weather was great. And I couldn't have asked for a better experience. And it's once I got back to Canada and I got back into work, it's a bit a week later after I got back from the trip, I started to have symptoms that I've really never had before. Um, they were very unfamiliar. And those symptoms were I was having like abdominal pain. That kind of just started randomly. I woke up one morning, I had it. Um, didn't really think much about it. I was like, maybe it's something else. Maybe I ate something, maybe I caught something from down south. All those questions that are going through your head. But you're not trying to freak yourself out either, right? You're trying to just kind of go with the flow, see if it passes, over the next few days. And then it did not pass. I mean, it actually progressively got worse. And then I started to have a fever that I just could not break. It was a fever for multiple days. That's what brought me to the emergency department the first time, was the abdominal pain and fever. Because I actually tried to access virtual care first, and virtual care actually wouldn't even see me. And they said, you need to go to the emergency department. And so I went there and waited a few hours because that's just how our healthcare system is here. But I was eventually seen by the doctor, who ordered a CT scan of my abdomen. But at that point, prior to even the scan, the things that we were considering were things that could be resolved pretty quickly, no acute issues. There was also consideration of, maybe I did catch something from Dominican. At that point, it sounded like, this might be what it is, and here is the solution to this. But I went for the CT scan and waited for the results, and the doctor came in, and he was like, he looked at me and he said, "You're not so straightforward. We found blood clots in your liver and spleen." And I probably turned white as a ghost. I was panicked. I was freaked out. I was not expecting to hear that news. I really wanted it to be something else that was a lot more easier to manage and figure out. He didn't have an answer as to why the blood clots were there, and I can just hear the tone in his voice. He was concerned, which made me concerned. And I had my partner next to me. So I'm so grateful that I had support in that moment that I can lean on, because there's a lot of questions and a lot of unknowns and not enough answers at that point. And eventually I was referred to internal medicine, their team, who came to see me that same night that I was in an emergency department. And they did an assessment. Essentially, after the assessment, they all came together, sat me down, and they were like, "Yeah, you have blood clots, and we don't know what caused these blood clots. These are unprovoked, or what they would consider to be unprovoked." And they said that, the course of action here would to start me on a blood thinner. They took a whole bunch of blood from me. I can't even count how many tubes of blood that they took. And they said they will follow up with me in 2 to 3 months with those results. I was like, okay, I guess that's what we do. That's how we're going to approach this. I was a little bit naive at that point because, again, I hadn't accessed healthcare much prior to that, right? So I thought, I'll go along with what they're saying. And I left, I started the blood thinner, and 2 days later, I was back in the emergency department with the pain had worsened significantly. I was still fevering. I was extremely weak, fatigued. I was nauseous. More symptoms had come, and I was like, I don't know what this means. And I'm scared that I'm going to die. That's what was in my head. I was asking myself over and over, ruminating on it, of like, what if this means I'm dying, right? I was 26 at the time, and, as a 26-year-old, to have to ask myself that, and try to prepare myself for that potential news, it was pretty scary. And I ended up going back to the emergency department. My partner took me again, and within 20 minutes, I was seen. And he was a different doctor who his response to my symptoms and what I was experiencing was a lot more, I guess he was a lot more concerned. He was like, okay, we're going to figure out what's going on. You shouldn't have been sent home the first time. You should still be here. And I'm glad that you came back. Again, the initial reaction was I had caught some sort of infection from Dominican Republic. They started me on IV antibiotics, thinking that would help with the fever, which it did, luckily. Also, strangely, that it did help with that.
How did the diagnosis of PNH happen?
Essentially, I was admitted to hospital after I went back the second time to the emergency department. And they kind of looked at me as this kind of, you're a case to be solved, right? At one point, a resident came in and called me like the $1 million workup because they had no idea what was going on with me, and how to explain. There's just no answers. And I was admitted to hospital for 2 weeks. And within that span of 2 weeks, that's when I received my PNH diagnosis. Leading up to that, it was a lot of blood work, daily blood work, more tests, more tests. My symptoms were starting to reduce, which was nice. But again, we still didn't know what was happening. And I had another resident who came to see me, who eventually, he was part of my healthcare team my whole entire stay in the hospital. he came to me and said he wanted to kind of get a little bit more information about what was happening prior to me going to Dominican, because at that point the theory was still that I had an infection. And he wanted to know more about what was things like months prior to that, right? And it was a light bulb moment for me. And it kind of came back to me, and I was like, well, I did have very dark urine months before my trip. And I can't tell you the exact time, but I remember having very dark urine. It was early in the morning. I was waking up, and I called my partner in actually, and I was like, I don't know what this is. It's really dark. I've never seen this before. And we kind of go to this mindset that, maybe I'm dehydrated. Maybe I drank too much tea the day before. All those questions, right? And I just kind of let it go. And it really didn't happen. It took a few days for my urine to get back to normal. And I was drinking a lot of water, staying hydrated, and it never really happened again. And when I told the resident that, he was like, okay, we're going to test you for something that's called PNH. He's like, it's a longer name. He's like, I'm not going to try to butcher it. But it's PNH. He's like, Google it. I was like, okay. And he's like, we're going to test you for it. And so I Googled it, which probably is not the best idea in hindsight. But I was reading the symptoms, and I was like, this, the abdominal pain, the dark urine, the, fatigue, the weakness, it was all just kind of adding up in my head. And I was like, this sounds about right. And it was actually a Friday afternoon, a late Friday afternoon, that someone from my healthcare team came to me and said, at that point, they hadn't received the PNH result. And they were like, you're doing better. We might send you home. You would just be waiting here to get results. And we don't think that's productive for you. And so they were actually getting the paperwork signed to discharge me home. Until I said, I want to make sure. And I looked at the person from my healthcare team, and I was like, I'm okay to go home because that's where I would rather be, to be honest. But I want to make sure that we're not doing this prematurely. I feel like there's something that we need to figure out first. And they were totally understandable. And then 15 minutes later, the result for PNH came back, and it was positive.
And then what did the healthcare team talk to you about what your treatment options were going to be? And did you experience any challenges getting access to treatments?
So it's about an hour after the result came back that a hematologist came to see me in hospital, and I was in my bed with my partner next to me, emotional, of course, because I didn't know what this meant for me. She was a very lovely woman who's still my hematologist to this day, and I'm so grateful for her. She broke it down for me in very simple language that, hey, Shane, this is what's happening. This is what we've found, or this is what we're seeing. And this is what this means, right? And she was so comforting in that moment. It made me feel like, okay, everything is going to be okay. And it was when she said, the prognosis is good. The outlook is good. There's treatment for this. We're going to get you on treatment. We're going to figure out how to get you on treatment. Because where I live in Canada, very, very, very few cases of PNH, very rare. And this is still something that when it pops up for doctors, they are, what do we do with this, right? Because it is so rare. And actually, I had another doctor come see me who said that, he's like, you're 1 in a million. He's like, this is something we learn about in school, but in practice, we rarely ever see. And I just, I was like very scared, very worried. I was comforted by the idea or the thought that there's treatment for this. But it was the road there, the journey there. How are we going to get there? How am I going to afford it? What does it cost? Um, am I going to have to make these changes in my life so I can afford and get treatment, right? And all these what ifs and unknowns and uncertainties. But they were reassuring that we would get treatment. And so the journey started to get treatment, to get me started on treatment. It took about almost 4 months post-diagnosis to get confirmation that I had funding for treatment. We started a week later after my diagnosis with the paperwork, with looking at different insurances, getting connected with patient support programs to see if they can help. We were on the ball, and for some reason, we had such a difficult time securing funding for treatment. This treatment, I'm on Ultomiris. Originally, we were trying for Soliris, and this treatment is almost over $700,000. And I can't afford that, right? And we were looking at different avenues to get funding, and it was consistent declines. No, no, no. And it was like passing the buck to see who else would want to cover it. And we were unsuccessful with Soliris. We tried Ultomiris. And in that process too, I was really advocating for myself. And, I was doing a lot of research on my own. I wasn't only putting this in the hands of my healthcare team, because I'm part of my healthcare team, right? And I get to make decisions. And I have a voice and I have a say. And I was doing my research. And, even during the process of trying to find funding for Soliris, I was like, well, there's this other drug that's approved in Canada, Ultomiris. Why are we not trying to get funding for that? Right? And it wasn't until we were unsuccessful with Soliris that they came back and said, oh yeah, Shane, we are going to try Ultomiris. And so is a lot of self-advocacy. My healthcare team is amazing. It was more so external folks that were on my case that were helping, that it was just taking a little longer, the process. And I understand that there's process to everything, and that's important, but also recognizing that my life is hanging on a thread here. It's in the hands of other people, and that was out of my control, and that felt very unsettling for me.
And how have you been doing on treatment?
So treatment is going great. I started treatment back in September, and I've had 3 treatments so far. So I get them every 8 weeks, and they're going incredible. I had my third treatment about 2 weeks ago, and I had no side effects at all, which was a huge change compared to the first time I got it. But I've been feeling really well. Treatment's going really well. I was getting blood work. I was going for my follow-up appointments at the hematology clinic. I was doing everything that I could do to ensure that I was getting the care that I need. I was staying on top of things, doing my own research. And I think because of that, in part, I'm doing well and I'm doing better. And actually, as of recently, my blood work has improved so much that my hematologist has, instead of meeting monthly, our appointments are now every 2 months. Instead of weekly blood work, I get monthly blood work. And I actually went for a follow-up CT scan not too long ago, just to kind of see how things were going. And I actually got news last week that my blood clots have dissolved.
That's awesome.
Yeah.
Wonderful, wonderful news.
Yeah.
So throughout this process, what have you learned about yourself, and what do you want other PNH patients to know?
Yeah. I've learned that I am capable. I learned that, you know, I am my own advocate. I'm my best advocate. It takes time. You're having to insert yourself in conversations. It takes energy that as a PNH patient, especially prior to starting treatment, I just did not have as much of. And I was having to put my physical and mental health on the line here to have a voice. And it was tough, but it was so worth it. And I'm so glad that I was able to advocate for myself, because I don't think I would be where I am today a few months later. Treatment is doing its job, it's working, but to heal and to recover and to bounce back from such an experience, um, it takes a lot more than just treatment, right? And it takes instilling this confidence in yourself to know your body, right? And when your body is telling you you're not okay, and listening to your body when you're not okay, and keep pushing forward, keep moving forward, so you can get the answers you need. Because it's not always about people's intentions, but it's really a lot about people's impact. When you're feeling like you're not heard, that impact is great, right? And I want other PNH patients to know that it's okay to speak up. It's okay to ask questions, to get clarification. It's okay to want care and to want the best care for yourself. And that life goes on, right? It looks different, right? It is different, but it's different for all the good reasons, for all the best reasons. I know myself a lot more now, and I'm a lot more confident in how I move forward in conversations with my healthcare team. And, I feel like I've built that respect. And I only feel like this is just the start of something really great. And I just want people to know that your life can improve and will improve. You need to be in the driver's seat.
Thank you so much, Shane, for sharing your story with everyone, and it will have great impact to encourage and inspire other PNH patients. So thank you so much of sharing of yourself. And if you'd like more information about PNH and the treatments and how to find a second opinion for yourself, which I'm sure Shane will say saved his life.
Yeah.
You
Yeah.
can find that information on our website, which is aamds.org. Thank you so much, Shane. Would really appreciate it.
Yeah. Thank you for having me, Lee.